Okay, part 3. I'm going to learn how to edit these videos, intro and outros, in good time. Now, in part 2 we talked about the autonomic nervous system and its branches, the sympathetic, fight and flight, and the parasympathetic, rest and digest. Now, you may be wondering how this has anything to do with your chair killing you and anything to do with your office environment, and why I'm asking you to get in touch with your inner animal. Well, all will be revealed in this third part of the video series. When you're in a situation of threat and your sympathetic nervous system is predominant, there are natural postures that you take on to protect the vulnerable structures of your body. In evolutionary terms, it would have been to protect you against assailants, apex predators, other humans, Homo sapiens looking to take your territory. And with that, we still carry a lot of these conditioned genetic, environmental and evolutionary responses, and they're employed today inappropriately in response to threat. When we talk about threat now, well, we're not talking about a saber-toothed tiger, we're talking about 15 emails waiting to be answered, the phone ringing, someone knocking on your office door, the children at home needing to come home because they're sick, your parents wanting to visit for the weekend, not sure if you can afford to go on holiday, repaying the mortgage. And these are the superficial issues. The deeper issues are, why am I doing a job which I don't enjoy? Why do I sit on my backside all day with this deep feeling that something is intuitively wrong? What should I really be doing, and how can I help myself? If you're asking yourself those questions, you're starting to move in the right direction. So, office posturing in response to the sympathetic input from our environment. We're talking about the threat. And by threat, I just mean something that needs response. And our smartphones, are tools that are used to influence us by certain industries, to train us in distractibility, to reduce our attention span, to give instant feedback, and also to foster a sense of dependency. And that is done on a deep psychological level, and we have physiological responses to that. You have a dopamine release in response to recognition of one of your photos on Facebook. You get the blue thumbs up, you get the little hit of dopamine, and you want to come back for more. And when you don't have that, you have this mild sense of anxiety, this mild sense of lacking, and you have this baseline sympathetic state. I don't need to tell you that it comes from other means as well, such as there's the media and the evening news, which is a horror show of threat and fear mongering. Happy days, eh? So anyway, back to the office. Why? What postures do we take on in the office? Well, I'm going to work from the top of the head down to the belly. Now, priority number 1 for us as bipedal erect organisms is our brain, which coordinates everything that sits at the top of our body, obviously, and we have the primary sense organs of the eyes. We rely heavily on our eyes. Now, how would we protect our eyes, delicate as they are, from attack and injury? Now, they have a bony orbit around them, but in order to enhance that process, we then bring up more soft tissue, more muscle and flesh around the eye socket, and also by frowning, furrowing the brow, we give extra protection to the eyeballs from lateral attack and from strikes. So when you see people peering at their computer like this, it may be peering at their computer like this, it may be because the print is small, but it is also to do with a sympathetic response, and a need to protect the eyes. Okay, now we move down to the jawbone or the mandible. Now, you struck in the correct place with the right amount of force, the mandible can essentially be an off switch for the brain. And that is because the mandible joins the skull at this joint here called the TMJ joint, which is in the base of the skull. We move backwards within the deep and thick bony structure of the base of the skull is the core brain areas, so the base or primary brain function areas. In amongst that, something called the reticular formation, which is an area of the brain involved in consciousness and arousal. Now, any force transmitted through the mandible to the TMJ is transmitted to the reticular formation and renders unconsciousness. And if anyone who observes combat sport will see that people have different thresholds about which they will become unconscious, and that's thought to be due to thickness of skull, the amount of fluid around the brain helping it absorb strikes, and there's also been MRI studies done to show a ratio between these measurements and the ideal in terms of low concussive threshold. So obviously in evolutionary terms, it's not an ideal response to the fight or flight situation or to being struck to be rendered unconscious. So one of the evolutionary mechanisms we've developed to reduce that happening is to clamp the lower jaw to the upper jaw using the muscles of mastication, chewing muscles. We clamp it to the upper jaw so that when we do go to strike, there's minimal transfer of energy to the reticular formation and reduced risk of unconsciousness. Now, I have an idea for a study which it is highly unlikely I'm going to get ethical clearance for, and that is, I believe that people who are prone to tension headaches, which are muscular headaches, well, temporal tension headaches, which are muscular headaches around the temporal region here in relation to stress, and also people who grind their teeth at night, I feel probably in evolutionary terms have a lower unconscious threshold and therefore are more prone to tensing their jaw and tensing their facial muscles to stabilize the joint, the jawbone, to limit the effects of a strike. Now, finding ethical clearance to do this is not going to happen, but you know, it's an interesting theory nonetheless. So here we have good reason why grinding the teeth, tension headaches, and TMJ pain is often an issue when you're in a sympathetic predominant state. Now we move down to the neck. We have the neck's an amazing structure. I mean, you know, it maintains and moves the head in multiple directions. However, it's incredibly vulnerable. You've got the two major arteries which carry oxygenated blood to the brain, the carotid arteries either side here. In the midline you've got the one tube that brings oxygen to the lungs, and all three of these structures lie, you know, less than half a centimetre below the skin, very open and easy for attack. So in order to protect these delicate structures, what do? We raise the shoulders, we reduce the potential for lateral impact towards the neck. I'm not sure what that was. The impact of lateral strikes towards the neck. Now, you can see this in action in combat arenas with the Philly shell, which is what Floyd Mayweather uses as a tactic, which is where he uses his lead shoulder to protect these structures from a jab, if it's from an orthodox standing boxer. So we take on these postures throughout the day if we're in a sympathetic state, and as you can imagine, over a long period of time, even over a short period of time, these are not good postures for your health. And as we move down, we can see that there are more. The belly, which should be nice and soft, free to move, expand in and out. In most people there is rapid, shallow breath because they're in a sympathetic state. They're anxious, mildly anxious, and they're breathing, and they don't realise they're doing it. And often I see patients who have panic attacks and they come in and they say, oh, I have tingling at the end of my fingers and around my mouth. And that's because they're hyperventilating and they're blowing off carbon dioxide, which is one of the things that we expire and one of the toxins we get rid of. And if you blow off too much of it, it affects the blood vessels and you get, particularly in the peripheries, and you get tingling. In extreme, you see that in panic attacks. In a mild scenario, you see it in people who are just stressed and having low levels of carbon dioxide or reduced concentrations of carbon dioxide affects blood vessels and perfusion of the brain and many other things, and changes the physiology. Now that soft, gentle, slow moving in and out of the belly is due to the diaphragm flattening down, pulling in oxygen into the expanding lungs. The belly goes out, then it all relaxes and you expire. And the ideal, if you're in a real parasympathetic state, is that you're breathing in a slow, comfortable, steady rate. Ideally breathe through your nose to maximise your nitrous oxide intake, which again has an effect on the blood vessels and therefore blood pressure. So when we scan down our body, you could do this every hour while you're at work, starting from the top of your head. Just have a think about, how are my eyes doing here? Am I peering at the screen like I want to knock someone out? Or am I relaxed? Is my face relaxed and soft? How's my jaw doing? Is jaw nice and soft? Good. Where are my shoulders at? Are they up near my ears? My trapezius muscle, which are the two big muscles here, really tight? Or am I, shoulders back, shoulder blades drop down the back, arms resting, and am I comfortable? Is my belly soft? And what we're tapping into here is the phenomenon that you fake it to feel it, and it's been proven with smiling in that when you smile, trying to smile with the eyes and the mouth can be a challenge. But when you smile, even if you do just smile with the mouth muscles, there is a hormonal internal response to that, and associated feelings of connectedness and happiness. It's a mixed picture and there's lots of confounding factors, obviously. When you walk around and you smile, the reciprocation you get back from your environment is more warm, more welcoming. And again, that has an evolutionary origin, that you aren't a threat, but you look less threatening to other people because you're smiling, and therefore they're more welcoming in their non-verbal communication with you, which, as we know, is 93% of the communication. So yeah, walk around for an interesting experiment. Walk around without smiling, and then walk around smiling, and get a little feel for the difference between the two. And the other thing that I noticed, or I'd like you to notice, to try and take up the practice of hourly body scanning while at work, to ensure the eyes, jaw, shoulders and belly are as soft, balanced and gentle as they can be, to try and keep you in that parasympathetic place and limit the sympathetic predominance that is so common in today's world. And with that, I will leave this current section of Health Hacks with Dr. Andy James. Until next time, take care of yourself.